Hello, and welcome to our presentation of augmented reality and virtual reality in healthcare. I'm Melinda Foss-Riley-Jarrick, and presenting with me is David Chapman, Jean Frank, Jennifer McLean, and Frank Niesenbaum. Augmented reality, or AR, and virtual reality, VR, are fairly new to healthcare. We are presenting an overview of the potential and current use that are available in the hospital setting today. We will turn it over to Jennifer to give you an overview of AR and VR.
Hi, yes, I'm Jennifer. Okay, yes, I'm gonna go and give you a little bit of information of the AR and VR. For AR and VR, there are two very new realities that are being leveraged in healthcare. One is augmented reality. Augmented reality improves patient care, adding pop-up information and other navigating experiences that provides a new tool for patient evaluation. It can help in diagnosing a patient's problems by reacting to sensors and then visualizing what could be causing the problems. It helps a doctor look through the layers of a patient without having to cut into the patient and help with precision of diagnosis. It can also show stats right on the body. Now I'm going to give a little bit of an overview on virtual reality. Virtual reality is the other. It provides simulated experience that can vary under circumstances. It will help understand the patterns of disorders and help develop new, more effective treatment strategies. It helps as far as proving very helpful in treating PTSD by adding relaxation and stabilization for patients within those circumstances. For teaching experiences with AR and VR, I'm going to now hand it over to Frank.
Thanks, Jennifer. I am Frank, and I'm going to talk briefly about how the virtual reality creation has helped in medical education and training. Obviously, we all know the pandemic happened, but before that, even as early as 2009, Dr. David Clark performed a virtual reality-based simulated surgery to remove a brain tumor. Very, very advanced. But as I talked about in 2020, with the pandemic, the VR adoption rate saw a massive increase in every hospital and medical university that was looking to implement these applications to help train the professionals in medical education. The old days, as it were, and still are, but usually trainees would develop these skills by watching their mentors. They would be live at tests and surgery performed on a live patient and cadaver. But again, with COVID, things changed a bit, and there weren't as many elective surgeries, so there was a shrinking number of things for people to watch. And in that type of world, VR is offering a safer learning environment. We're created for trainee surgeons. They can be in simulated operating rooms, watching, having mentors there to help them with techniques and skills, get valuable experience with getting feedback from the senior surgeons without having to actually perform the surgeries that may not be available to them, but give them a lot more ways to practice. So it's a really great tool in education, and it was something that COVID really helped create. And now David is going to take us through one of the companies we evaluated that is leveraging this technology.
Senti-AR is a new medical technology manufacturer located in St. Louis, Missouri. Their motto is AR reinvented for the OR. They specialize in the creation of a real-time, interactive, 360-degree view of the treatment they're delivering, which has been adapted to cardiac ablations. Senti-AR is a for-profit company which has a B2B business model, which was founded in St. Louis at Washington University in St. Louis in June of 2017. It's currently headed by Burke Toss, Jennifer Ibarri Silva, and Jonathan Silva. They basically utilize medical holography. We'll talk a little bit about that later. A command EP system allows surgeons and interventionists to see 3D real-time holograms through a wearable headset while they're conducting procedures, specifically cardiac ablations. Senti-AR is a digital health software device company. With these procedures, the image of the heart, complete with the targeted lesions, floats over the patient. It's a hands-free system, which is appropriate for use in catheter-based procedures in the cardiac catheterization lab. Since the AR system is moving quickly in business, and it received a 510K clearance from the U.S. Food and Drug Administration for the Command EP system. They also announced a $5.1 million Series A financing and expanded its team of employees to 12 recently. It has transitioned from an R&D venture to a commercialized startup, and recently has gone through 8 rounds of funding, receiving over $15.6 million in total funding. This is part of the global medical holography market, which essentially is one of the newest changes in medical care, and that market is expected to reach a high compound annual growth rate, or CAGR, of 33% during the forecasting period of 2022 to 2029. Holography is a technique of creating an exact visual representation of an object in 3 dimensions using light as a source to record it. And the benefits that holography provides are substantial, and it's a performance improvement over the conventional methods that we've used in the past of understanding human anatomy, such as 3D images from CT scanners, MRI scanners, and radiography, which don't allow enough accuracy or precision in diagnosis and description of the patient's anatomy. Discussion
Technologies
to
is an innovator
Gene
in the
Frank.
dental technology space. The company, founded in 2012 and based in Lansdale, Pennsylvania, is a privately held corporation employing more than 35 employees and reporting $8 million in revenue in 2021. XNAV Technologies was founded by Edward Marandola, an engineer interested in cone beam technology and its applications, Chris Scharf, who heads the business development team, and Robert Emery, an oral surgeon. XNAV holds 8 patents and has currently applied for 35 more patents. They received 510K clearance from the FDA for their XMark virtual-based navigation technology in mid-2020 and reported that more than 150,000 dental implants had been placed using the XGuide technology by September 2021. Notably, minority funding has been received from Invista Holdings, a stakeholder in Nobel Biocare, which is a major player in the dental implant market. Until recently, Nobel was the exclusive distributor of the XNAV, even though any implant can and really should be used. The XNAV robotic surgical system is an evidence-based dental navigation system. The software is iOS-based and open, compatible with all cone beam CT systems. It is compatible with most intraoral scanners. The XNAV uses proprietary software to coalesce the information from the scans, the patient, and the surgeon, enabling the surgeon to virtually complete the surgery in a digital format long before the patient actually goes to surgery. It is important that the platform is able to use different CT and intraoral scanners because the CT and scanner space is flooded with different products, and there are numerous combinations of data sets that could be used by the dental surgery office. The XNAV makes it much easier and more predictable to perform dental and maxillofacial implant procedures using their system. It is simple as scan, plan, and navigate. To begin, a cone beam CAT scan is taken of the patient while wearing a special QR-coded clip intraorally. This orients the patient to the CT and the XNAV machine in space and is eminently reproducible in vivo. An intraoral scanner is used to scan the existing dentition and supporting structures. The 2 data sets are coalesced into a virtual digital patient, which is an exact replica of the real patient. The surgeon performs the surgery on the computer, making adjustments as he plans, inputs his hardware selection, and the digital plan is created and uploaded to the XNAV machine. Parts are ordered, and the patient can be scheduled appropriately. When the patient is brought into surgery, the QR clip and another orientation device are placed intraorally and QR scanned by the scanning arm, which is positioned 60 to 80 centimeters above the patient. The live patient and the digital twin are meshed in real time, and a single augmented reality patient is created on the screen placed next to the patient. The X mark is created on screen and the robotic assisted surgery proceeds. The surgeon is able to visualize all aspects of the patient simultaneously in augmented reality. Placement of the implant is incredibly accurate due to the real-time continuous scanning of the patient during surgery. Any movement of the patient is accounted for and instantaneously corrected in the surgical X-guide on screen. Better, more accurate, and more predictable hardware placement and patient outcomes are associated with this procedure. The innovative and groundbreaking XNav Technologies product line promises to deliver affordable, predictable, less invasive surgical solutions to dental surgeons and to their patients. Minimal trauma resulted on this surgery due to the AR guidance. A clinically stable and appropriate result is shown in this PannerX film.
Thank you so much, Jean, for that excellent talk. And I just wanted to add to that XNav Technologies is a medical technology manufacturer located in Phelpsville, Pennsylvania, and they also received a 510 U.S. Food and Drug Administration clearance to expand the use of that X-Guide dynamic surgical navigation system. It's a B2B business model. Now I'm going to allow Mindy to tell us what we just heard.
Thank you. Augmented reality and virtual reality applications are numerous and can minimize unnecessary blood loss and invasive procedures for patients. The economic growth from AR and VR will be a huge disruption to traditional medical procedures and practices, but will make recovery easier for the patients.